Okay, welcome back everyone to part 2 of our, kind of series now on how to build a mental health ministry in your faith community. And we are joined again, of course, by Carolina and Mariana, who are part of our Gateway to Hope mental health training program. And of course, Matt as well. So yeah, I'm excited to continue this conversation and just keep it going.
Thank you for having us.
Go ahead, Carolyn.
So as Emily was saying, my role at Gateway to Hope is community education coordinator. So I get to do a lot of really cool things in the community. I get to go out and train different communities, just from workplaces, organizations, schools, and churches. So we do different types of trainings. I think our biggest one in churches is Empower, which is great for someone. It's really great for everyone. We've had counselors take it who say that they learned something new. We've had people who this is their first introduction to mental health. And of course, it's all great information for them as well. So our Empower training covers how to recognize signs of a mental illness, which is really great because I think a lot of times when people start to have that mental health conversation, they say, oh, well, I don't know if that's depression or if that's a bad day or what that is. And I'm almost scared to have this conversation. So I'm going to turn the other way. And so we really want people to not do that and to know that, okay, you don't need to know how to diagnose. You just need to recognize the signs. So that's the first part that we cover in the training. We also talk about, okay, if you do recognize the signs, what's the next step? So that's the refer piece and making that really valuable connection to a mental health professional. We'll also talk about how to relate. And I think this piece is probably people's most favorite part. It's a really valuable piece because it's practical tools that people can use in crisis situations or emergency situations, such as how to help someone who might be having suicidal thoughts, or even how to help someone with a panic attack. How do you de-escalate a situation? Most of the times I get the best feedback from that portion because people can say, okay, if I'm faced with this problem tomorrow, I know what to do. We've even had a situation where we just finished that module at a training, and then someone came up to us like 20 minutes later and they just said, my son called me, he was having a panic attack and I was able to help with what you just taught me. And I just can't believe that it was like such a quick turnaround. So I think that's really awesome that they get to use it right after. And then finally, we talk about how to restore through a supportive community. And through that part, we will plug that community to other Gateway to Hope resources, which we always have new trainings. We always have new resources developed for different communities. So that's a little bit about the work that we do in Empower in churches.
Yeah, and we've got a lot of new things coming down the pipe too. You know, we do right now have a mental health coach training. We're about to do a revamp of that where we'll focus it around a therapeutic curriculum more, and even toying around with the idea of being able to provide some type of supervision or a practicum for people to work on a support line or assist. We're going to do a pilot program here soon where we have mental health coaches helping parents at schools when their children are having mental health problems, help them find resources and stuff. So a lot of great stuff coming down the road. Now, I would say that one of the kind of, I don't know if I'd say it's a myth totally, but things that I run into a lot is that the way faith communities kind of think about mental health issues a lot of times, number one would be that that's a problem that people outside the church have, and then they're coming here for help. And there certainly is some honesty in that. People do come that don't belong to the church, but research shows that people in churches and outside of churches suffer with mental health problems at the same level. So really, it's an us problem. It's not an us and them problem. And then I think the other thing is because of the kind of the culture we live in now, a lot of times people think of people with mental health issues as dangerous. And I unfortunately see churches a lot of times more driven to try to develop security at their church to kind of stop the potential for what they often think of as a mentally ill person coming in and shooting up their church than they do in investing in trying to develop kind of mental health ministries or mental health supports within their church I've run into that myself as we've developed this program over time, where you might hear things like, well, I'm not sure if we want those kind of people to come here. The response to that is, well, those people are already here because they're you and, they're all of us. And so, what about other kind of myths or concerns, might we say, have you guys run into that churches kind of might say, well, I'm concerned about X, and that's why I really don't know if I want to do something like this?
I think going back to the wanting to do action farther than just praying, it's really, they feel like the only thing that they can or they're equipped to do is just praying. So it's really, once they get equipped to respond beyond the prayers, really shines a lot of light into like action pieces to what to do. But I think I wouldn't call it myth, but I think that is a big, like, kind of where they feel satisfied to respond in prayer, but once they go beyond, it really does a lot.
Yeah. And I think I'll add to that. I think when we talk about stigma and these barriers, you can't ignore the fact that culture is a huge part, and different cultures are going to have different barriers and different cultural beliefs that kind of don't allow them to receive help. So both me and Mariana are Hispanic. So we've really gotten to immerse ourselves in the Hispanic community with Empower in Spanish and other trainings, such as mental health coaching in Spanish. And so we've been able to see firsthand what those cultural barriers are in that community, as well as, of course, we have our experiences of that as well. And typically what you'll hear is, oh, you can just pray. You're just not praying hard enough. You need to go to church more. You need to be thankful for what you have. You have nothing to worry about. What are you anxious about? And those are typical things that, we've heard in our personal lives, but we also see it when we're at these communities. I think we have a great benefit that we are Hispanic, so we're well received by those communities. But I always have to say, when I'm in a community that I'm not a part of, I always remind them that they know what the barriers are. And so if they can help me out in dismantling those stigma issues, then that's really helpful for me as well.
And that's easily done once you have the support of the church, and the support can give you some insight into what hasn't worked in the past, or how can I approach this situation or this answer, because the modeling component of seeing higher ups or senior pastors, senior staff, really starting these conversations and starting normalizing and debunking the stigma. It's really what again keeps driving the conversations.
And another issue that I don't think we run into it as much anymore, kind of post-pandemic, but I used to run into it a lot, and occasionally I guess I might still hear it, but is a concern about liability issues. Mm-hmm. Like somehow there's a liability issue for us to provide any kind of assistance or support to people. And the reality is that nothing that's being offered at the church is a professional service. It's just that, it's support. It's really no different than what's being done for people. If somebody came in and said, I have cancer, mm-hmm. It's no different than what would be being offered to someone who has cancer. You would be offering them encouragement and support and prayer, and you would offer physical help in the sense of maybe you would help pay for their electric bill or go and mow their grass. Or, I mean, it's a lot of the same types of things. And so, this idea of liability, like, well, there's a liability if we offer a support group. Well, no, there's not, because it's not professional service. It's a peer delivered support. It's no different than a Bible study. I mean, you really have the same level of liability that you would have for a Bible study for widows, because you've designated a problem, they're a widow, and you got them all together and you're offering them support. And so, we're very careful about that. And we do have a lot of, as Carolina mentioned earlier, we have a lot of resources like consent forms and templates and things like that if you want to use those types of things. And so that's really I often find that to be kind of more of a cop-out than it is a reality, because there is no difference than what you're already doing at a church. And so I just wanted to mention that one, because I used to hear that a lot. I haven't post-pandemic heard it very much, but I've heard that a lot. So maybe we could talk a little bit about some successes. So I wanted to just start out by saying this. I mean, I mentioned earlier the idea of, that's for the big church with all the money. The smallest church, I think it was before you guys even actually started here, and you've been here for several years. So the smallest church that I ever did the training in only worships 15 people on a Sunday morning. And they have a bivocational pastor. That means he's the pastor and he has a full-time job also. And so that isn't the pastor. He worked at a railroad yard. I mean, and they have an impact in their community. I mean, I probably had half the church there for the training. And so that's another kind of, we got to be big for this. I mean, I guess in some, if I want to be like really spiritual here, I could say, Jesus changed the world with 12 guys, so it's not like, you need a lot of people here. I mean, you just need to recognize that there's a need, and whether you feel there's a need in your church or not, I can tell you there is a need because that's what the data shows us. So maybe give us an idea of some successes you guys have seen in churches or maybe some surprises that you've seen once these things were implemented.
Yeah, I'll talk about a surprise that I saw. So like I mentioned before, we get the privilege of talking a lot to the Hispanic community. And when you're talking to that community, you really realize that there's a lack of resources, specifically free resources in Spanish. So when I do my Empower training, I talk about grounding and things like that, and mindfulness, which is a grounding piece. And when I do this in other communities, it's like a review for them. So I'm always like, so we know about, everyone here is familiar with grounding, right? And I get people nodding. It was really surprising to me that word doesn't even exist really in Spanish. So whenever I was in a community once, I said, okay, so you guys have heard of grounding? And everyone was like, no. I was like, what about mindfulness? And they were like, no. So it was a privilege to be able to, expose them to that. But it was a huge surprise. And it really just demonstrated the need that this is not, even though we live in Houston and we have a huge Hispanic population, these resources aren't available for that community. And typically they're not available for free. So that was a surprise. And it was a rewarding experience to be able to help them out in that way.
And to connect that same response to, I witnessed that same response in a African-American church whenever we started talking about grounding tools, or sometimes the world sees this as meditation and whatnot, but whenever we really emphasize that it's all your brain ability to come back to the present, that was something that they felt was a luxury or something they had to go out there for a professional to teach them how to do, instead of a technique that they are equipped to have internally and practice and use. But I think one of the surprise and success story that I've witnessed, to go to a different demographic, was the Asian American church that we did back, that I've already mentioned here in this podcast, that we did in April. It was very surprising to see the turnout for the event. We had over 150 people come up for the training itself, and we even have more for the previous speaking event that Matt did the day before. But not only was it the fact that they were there, but also the engaging conversations that happened after. I think during the Empower training that we had, I stayed a good 30 minutes just answering questions and people saying either thank you for talking about this or their own testimonials. So it's always just beautiful to see the response. And Caroline and I are just two-person, and this started with you, Matt, but we're not just like our team. We're not made out of 100 staff. So the church, it's not expected to also have 100 staff. It starts with 2 people, even 1 person, and so on. So that is always great to see.
Yeah, it honestly is just giving people a structure and some very simple resources on how they can better support or better minister to people that have these problems. And so, one of you mentioned earlier, people will say things like, well, I don't know anything about mental health problems. I don't know what to say. And I often will say to people, well, you don't know anything about cancer either. I mean, if somebody comes up to you and they say they have cancer, well, you at least feel compassion, and so usually out of that compassion, you'll take them a casserole or do something, and it doesn't necessarily directly impact their cancer, but you show them compassion and comfort and encouragement or whatever. And it's really the same thing here. I mean, we're not asking people to become, psychiatrists or psychologists or do diagnosis, or it just giving people some tools where they can feel more comfortable and be more effective in helping individuals. A majority of people with cancer receive treatment. Virtually everyone with cancer will get treatment. but a majority of people with mental health problems will never receive any treatment. That's our modern world. They just don't get care. And there's reasons they don't get care. But, if you could help them if you could do nothing more than help them get to care, then you've done something miraculous, because most people will never get to care. And to be able to combine that with your faith, which we all here at the Hope and Healing Center believe faith is an important part of a person's recovery and a big part of who they are. I think that's an incredible opportunity. So why don't you guys, I don't know, you've talked a lot about doing it in Spanish. And I will say the Asian American churches, that last one we did, we've only done a couple because Asian Americans are the group that's least likely to access care. There's really the greatest kind of stigma in that group. They're very difficult to engage about mental health. And so that was that's a very unique, it's a very large Asian American church too, which is very odd too, because it's huge. And but they're really very progressive when it comes to mental health and support. Give a couple ideas maybe of, I don't know, maybe some simple first steps you might have seen in a church that, might kind of prompt somebody to think, that could be something I could do. I mean, that would be easy.
As far as actions in the church?
Yeah.
I think it starts with just first is we always say, like you were saying, you're not trying to counsel, you're not trying to do anything, but just having a listening ear. Because I will say, I think knowledge, like once you have knowledge, it really eliminates the fear and then implements action. So being able to understand that, maybe know the person, engage in meaningful conversation, because then that will engage meaningful compassion. And like you were saying, that's important into why you're responding. Why do you even care to begin with? And I think that's something that in general, whether it's in the mental health compartment and physical health compartment, just engaging in the conversation and the notions of caring can do so much.
Yeah, and I think we do a really good job at making our resources really accessible. So at Gateway to Hope, we do lunch and learns once a month. And so if someone is, interested in taking that first step and maybe getting trained in Empower, or they're maybe like, I think I need a little more information before I bring this to the leadership at my church. We provide a lot of introductory information. We'll even be a tool for them if they want us to talk to their senior pastor or provide them with information or stats or success stories or testimonials of people who've taken our program. So it really is just their willingness to take that first step. And we're happy to hold their hand as they do it as well.
And what you mentioned a little bit earlier, the Gateway to Hope program now has expanded outside of faith communities. So we do faith communities in, I think, over 500 congregations now. But now we do schools as well, public schools and private schools, teachers and administrators, training them in the same things. And now we have a Gateway to Hope in the workplace where we go into a company and train their employees. And so, I think with schools, it's a very big movement now across the country. There's a lot of calls for teachers to be trained more in mental health to help recognize kids that are struggling, again, particularly post-pandemic. I mean, it's always been an issue. Unfortunately, it's just one more thing we have to pile on top of teachers. But what I would say in the context of the faith community training is that, a lot of faith communities will not just have their their clergy and their ministry staff trained, or just their leaders. They'll have a lot of their congregation trained. So when you have your congregants trained on, for instance, the Empower training that we do, you're not just helping them in the context of helping them minister better at your church. You're helping them in the context of their family, help them recognize issues in their own family. It's very preventative in some sense, because it helps people catch things a lot earlier. So, having your congregants trained on how to recognize mental health care problems in each other and in their families and in their children, it's a very preventative type of measure. So, even a church offering, say, hey, come on Saturday, we're going to have a big mental health mental health training. Come learn how to recognize, how to refer, how to relate to people in distress, how to restore people through community, and offering that to your community around your church. Just doing that one event could be transformative for your church and for your community. It doesn't have to be some, like, we're going to set up a counseling center. That was the old style. The old style model of mental health ministry in churches was we'll build, if we got a lot of money, We'll either hire a pastor who has a license and he or she can counsel people professionally, or we'll start a counseling center at the church and charge people and offer that to the community. That is it's a very difficult to sustain approach. And what I often say is, well, that's what the world does, and that doesn't work. The majority of people never get to those people. They can't afford it, or the stigma. Do something different. And so, just offering a Saturday, half day, like, hey, come and check out mental health training for your community. It can make a huge difference. So, as we get towards the end here of the second part of our conversation, what kind of encouragements would you guys give to churches out there, or individuals out there that are kind of thinking in this, or ones who are thinking, this is something I've never thought about. How would I figure out whether this would be good for my church or not?
I think just getting it started, like we keep saying, do whatever it feels comfortable to you. And luckily, because we do have a lot of resources that are on our website, like you yourself have the pre-recorded training that is led by Matt, even starting with that, where if you don't feel comfortable having a full group or going into a location, that's always an easy way to get exposed to the information that we have, to then start being more like advocating for the content, or even for yourself and this message of what it's doing. And so the ability of having both that access to an online version or contacting Carolina or myself, it's always a start, but definitely just starting somewhere.
Yeah. And kind of like what Matt was saying before, just offering it to the whole church, you would be surprised how many people show up or sign up, because just if somebody sees that their church is offering that, and maybe them or someone in their family struggles with mental illness, they're going to feel seen and they're going to feel heard. A lot of times I'll be talking to a pastor or someone who wants to get this going, and they say, okay, well, I'll send out the flyer and the registration form and we'll see what happens. And there's always a huge surprise about how many people actually signed up, which again demonstrates the need and how desperate people are for this type of help. And so I would say if you're someone in a church who's not sure if your church needs these type of trainings, they do. It's really in every single church. People are dealing with this in their families in one way or another. And so I really do think everyone could benefit from our Gateway to Hope trainings.
I'll say to anyone who's listening, you should really go to mentalhealthgateway.org, and even like such a minor first step, check out all of the testimonials about the training. It really does work. You can see, real people and what they had to say and how this training kind of changed their church, changed their own lives. So I'll definitely leave that in the show notes. And then you guys have some really powerful video testimonials as well. And I just think that's great to check out, hear from real people who took the training and what a difference it made. Thank you so much, Carolina and Mariana and Matt. This was really insightful. And I think everyone listening, I know for me, whenever I have people send in questions or anything, or even reviews of the podcast, they're like, thank you so much for talking about this. It's so hard to build, they think it's really hard to build a ministry in their church. But like you guys were saying, there's some easy first steps that you could take, and anyone can do it. Matt says that all the time. You don't have to be any sort of professional to get it started. So thank you guys so much again.
Thank you guys
for having us.